Okay. Hello, folks. How are you? Hope this is working. If not, I'll learn from it. It's been a while. We've not gone live for a bit. Obviously, never stopped podcasting. Could never stop doing that. However, I think if I know where the buttons are, then I've got things working. There's a few new little features that I can play around with, and so I'm just trying to work that out. So if you are tuning in live, and if this is working, and if you can hear me, then please post in the comments. It'd be really nice to hear from you because we're deciding to bring Chewing It Over back as a live stream. And I'll explain in a moment why that even stopped. We've obviously still been podcasting. We've been doing it as a pre-produced and slightly edited. Let's go. Where's the captions? Hide that little ticker thing for a second. Good. I think I'm finding my way around this place again. Unfortunately, there's a retrobate called Jack March that's clearly tuned in. He said hello to me on YouTube, of all places. Now, if anyone more important than him is tuning in and can hear me okay on various different locations of which I'm streaming this, then please let me know, because it'd be useful for me to find that out and to make sure it's working, because we've turned all the buttons back on and it's been a little while since we've gone live. Oh, I can see in the background a little bit untidy on the plinth there, isn't it? But yeah, bit of teething problems, but yeah, lovely to be back with you. And I'll explain a little bit about what we're going to do with this show for 2025. Each Wednesday, as you can see, 12:30 till 1 o'clock ish. So lunchtime, Wednesday lunchtime, I'm going to stream. We stopped doing Chewing It Over as a live show, reluctantly to some degree, just because of the stability of the internet, and the product that we were using needed a stable internet that we just couldn't always guarantee, and that was really frustrating. And so we moved it back to a weekly show on Zoom that we then produced and put through the feeds. There were some people that found that frustrating, that it wasn't on their preferred location. There were some people that only use LinkedIn, for example, and found that to be where they found me, and so asked and hoped that we'd bring that back or post it on there. Once you had failed to stream it to all those different locations, manually uploading it to each individual one was a bit of a pain. So we ended up just being on the podcast feed and on YouTube. And so now hopefully we can cast this then again to Facebook and Twitter and YouTube and LinkedIn. And hopefully that's useful for you. And so you can then engage with it as live or after the fact. We'll also post that, especially successful ones that aren't glitchy and stuff. We'll make sure it's stable. We'll post those onto Spotify and Apple Podcasts and all that sort of gubbins as well. But generally, we're just going to test the water and do a few Wednesdays here in January, and we can do it that way. But it really is only the internet that made the sort of stability of that that made us stop doing it live. And so we prefer that format. We prefer this suite of products. And so hopefully, as I found my way back around it, we can get back going again with that. So welcome back for those that are tuning in, be that live or after the fact. What was always interesting is that some people tune in live in their lunch breaks or whatever. Back when we used to go daily for Chewing It Over, back just after or within the sort of what would still be considered within the pandemic. So you get a few dozen tune in live. You'd get then a few hundred over the course of the week that might tune into that show, and then a few thousand once it had gone out onto the podcast feeds. And so whilst it was interesting to see, it doesn't matter as much about your engagement during the sessions. It's just a way of us then streaming that out and also editing it on the fly, which means that when we cover a contemporary topic or we have a guest on that's really pertinent at the time, we don't have any delay to it going out that following week or whatever. So it goes out live, and then we can reproduce it across those other streams. So hopefully that suits you. Now, there's a few new features around here, some old ones as well. What have I got here? Chewing It Over live stream is back for 2025. And so that can exist there, but I can give you a little clue as to what we're going to be talking about today. AI and MSK. I'm going to keep this one brief, in part because I just wanted to make sure I tested the water, but also give you a bit of a clue, because I've not got a guest on today because I wanted to test it without one, but we will be getting guests on. All the people from our network that have got something interesting to say will come and join me now and again on a Wednesday. But as you guys might know already, I'm happy to shoot the breeze on topics, especially those related and adjacent to MSK healthcare. And one of the things that kind of crops up a lot and I get asked about a lot on social media and through our Physio Matters channels is is regarding AI and MSK, and that can be applying techniques and tools and software and things like that across different parts of clinical practice, education, how people are using it, and finding out as well how people are using it and innovating with the large language models like ChatGPT, Grok, Meta AI, that sort of stuff, which we'll talk about. But there's also then some fear and concern over AI and MSK services, AI physiotherapy, whereby, and I'll use some examples in a second as to how that's sometimes a risk of it being a therapist replacement and how we might mitigate those risks if indeed they exist. So that's what I wanted to just quickly shoot the breeze with you on today. And obviously, if you've got any opinions, then please pop them in the chat wherever it is you're viewing this, and they will pop up and I will get to them if I can. But if you get into this, like most people do after the fact, then obviously feel free to still post on the channels. I just can't obviously then act on them on the fly. Or you can always email us, info@physio-matters.com is where we aggregate our feedback. And so if you've got any ideas and thoughts on that, then please do let me know. One thing that I wanted to sort of highlight as a new feature on here is that I can pull up a QR code there. If you look at that top left of my screen, is a QR code. It says Joe T on AI. I'm going to go into the detail on this in a second, but one of my colleague Joe Turner wrote a brilliant piece for MSK Mag recently, relatively recently, a few months back, when there was news of AI encroaching on certain services and AI physiotherapy services, and that piece is here. ChatGPT, can you tell me if you want my job? If you would like to have a read of that, then please do check out the QR code in that top left-hand corner, or just search Joe Turner ChatGPT and you can find it just as I did. And that was a really nice piece that I will be reflecting on a little bit. And to be honest, you'll be getting a sort of butchered version of Joe's arguments to some extent, or her reflections from that piece, and it was a really good one, and that you should absolutely have a look at. So I'm just going to leave that in the top corner, just because I can now, and apparently that's how these QR codes work on this new streaming software. And so please, someone test that out for me. It'd be useful for me to know if that works, because I can use those again. But as the caption suggests, I'm going to be talking a bit about use cases. I'm going to talk about the compatibility then with the AI and MSK as I see it, as well as then reflecting on this therapist replacement concern that people have. Okay, so that's going to be what today's show's about, if that's all right with you lot, and I'll get stuck in. So one of the first things I want to say is that it's really interesting, and it's an emerging picture as to how AI is interfering, or I suppose being introduced across our sector. Okay, so MSK being what I consider the sort of pain and injury sector of which we work in. I'm a physiotherapist by background, but we work alongside our osteopathic, chiropractic, sports therapy, soft tissue therapy, sports medical, and orthopedic colleagues. It's kind of, we're raising standards in pain and injury and reflecting on how that might affect the care of pain and injury. Rehabilitation is central to that, and that's something that admittedly is a deep bias of mine. But when it comes to the way in which AI is affecting the world, affecting technology, its use cases across different sectors are plentiful. And so we're all learning about ways in which it can be used, good cases, bad cases. Sometimes it's being used in a bit of a gimmicky way for my taste, and other times it's a really interesting way in which it can be used to good effect. So just to reel off a few examples, and I'm always interested in yours as well, of course, but I've been using AI for 12 months now for recording and then interpreting my initial assessments. And so, for example, I'll have an AI software that will be listening into my consultation with a patient. So my start of my consultation says, if you don't mind, I use an AI software that listens to our conversation, securely stores it, but then basically it gives me a first draft of my documentation. So it means I can focus perfectly on the conversation we're having without having to make as many little notes and things like that as we go along. Is that okay with you? They consent. I then press go, and there's a microphone that essentially bugs the room, records it and stores it safely. And it gives me a first draft of my subjective assessment, and especially useful for initial assessments. You can use it for beyond, and there's all sorts of other ways in which I'm sure that particular model, I could use it more and I could use it differently. But at the moment, I've been using that for a good part, at least 12 months, I'm pretty sure now. And so that is one way in which AI can really help that. I can then ask that AI, once I've refined that documentation, I can then say, please send a referral letter in keeping with that conversation. And it will give me, again, a draft. Nothing ever gets sent straight away. You're always able to refine it and adjust it. And you can train that system to become better. If you don't like how it's decided to word it, or there's ways in which you can make it, make it elaborate more, or sharpen what it's said. And so that's just one way, one use case of which I've been finding it to be interesting. You might have seen these models. So Patient Notes AI is the one that I use at the moment. Heidi I've been playing around with as well. And then there are other tools, and no doubt that I don't know of, that do similar things, or maybe even better. So let me know if you've been playing around with that. There's also some interesting chatbot tools, such as Go Triage, that have come out on the market recently, whereby essentially ahead of an initial assessment, they get a link to then interact with a chatbot, which asks them subjective assessment questions. And so it gives a bit of a pre-assessment. So a therapist can then, and we use that in our team recently, we've been trying it out, especially for our more junior members of staff, to be able to then get access to an AI interaction with the patient ahead of time, basically screening, things like screening red flags and giving medical history, and the things that can sometimes take a bit of time up. Is you've got that, plus then the AI can give indications as to what it feels the differential diagnosis to be aware of, further questions that you might want to ask, highlights within that subjective assessment that the robot's done, just to mean that you can get ahead. We all know that sometimes if the notes that patients might give you in their initial, when they book in or whatever, that can be really useful insight, but also that a referral that might come from a doctor or from a colleague might well be laced with sort of biases, or a diagnosis that's too narrow for what you think it might be. Whereas this is kind of a useful way in which the AI can interpret that and give you an idea and scope as to where you might focus your attention from what they've said, as well as then giving a few clues as to where you might take things next. So, having a junior therapist making sure it says to rule out cervical problems from a shoulder pain. Now, you'd hope that a quality MSK clinician is not going to then fail to check for referred pain from the neck. But the way in which it might indicate that because of some of the answers given in the subjective chatbot assessment, that's why you want to be more thoughtful in that direction, can just give that extra bit of help to a patient. Sorry, to a therapist who's working with that patient. So another interesting use case of AI in practice that we've been playing around with Go Triage, and a really interesting innovation from them in terms of software and technologies. I've heard of other ways in which AI is developing in the exercise prescription model, the ways in which you can feed an AI with motion capture, with gait analysis. I've heard of ways in which you can then just, whatever information that you might give it, how the model's then been trained to interpret. I mean, for my taste, if I'm honest, that's where I start to get annoyed and I feel like it gets a bit gimmicky, is that if that AI is being trained on a model in which we feel is a little bit dated for us. So, for example, I've seen it whereby motion capture from say an iPhone camera feeding into an AI model from a gait analysis, it's then stripping it down and stripping it back and saying, this is a crossover gait on the left side, this is a heavy landing, this is how they're running badly or wrong. That starts to concern me, in that we've kind of hopefully moved past a model of biomechanical reasoning whereby it's that those things that it's observing that are different to the textbook gait would be then considered faulty. And I've seen AI, and obviously I'm not sure how much of this is actually on the market and how much of this is sort of prototype and stuff like that. So it's a bit harsh. Maybe I'm assessing something that's a young product, but generally speaking, obviously we get stuff sent to us to check over on what do we think of this. And I think that's where I think AI can be used for a bit gimmicky at best, but at worst it can sort of hark us back to an old model of practice and care, because it's something that the machine is needing to be taught rules. And hard and fast rules are something that we've kind of moved away from, and the grey area of MSK practice is obviously the majority, and that the reasoning of the oohs and ahs of understanding the contributors to people's pain from biomechanics is something that the robots maybe won't necessarily always respect that nuance. Now, fortunately, these clever large language models can understand and will start to then factor in trade-offs and nuance. And so maybe it's that if trained appropriately to take with a pinch of salt what they're finding, then maybe that will work. We've seen some really useful innovations in medicine with that, with regards to how AI is continually being trained to interpret imaging better. So CT heads, for example, was something that was very early, in that, from my understanding, AI reads of CT heads for things like stroke and tumor are superior in accuracy to radiologists, human radiologists. Now, if we think about what that then needs to be trained on, is making sure it doesn't overrepresent certain findings that might be incidental. And so if we think about how that model might be trained on reading spinal MRIs, knee MRIs, that sort of stuff, which I'm sure is coming, if not already existent, and might be already, from my knowledge, might be superior to human radiology interpretations, those models need to make sure they're not overrepresenting incidental findings. And then if that AI then is also writing a report, for example, that might get to the eyes of a patient or to a more naive, a young therapist or junior therapist, how young they are is relevant, then it might well be that we need to be stopping ourselves from succumbing to really literal structural reasoning again. You know, if it's not necessarily giving the context of which these might be age-related findings, these might be incidental findings, these aren't necessarily causal to symptoms, then we need to make sure that then we, as human interfaces with the patient, explain those things thoroughly. And so I think that that's something we need to use as a mitigation. It means that then, for me, it's not that we need to keep the robots out of the room and stop and not use them, because their accuracy can be brilliant, and that is a really efficient way of using technology. But if we don't also then make sure we train them in that nuance, as well as then we add that nuance when we're interfacing with the patient, that's really important too. And so I'm interested with where that goes. But just back to my gait analysis example, is that if then the structural specificity that I'm mentioning with imaging interpretation becomes the same sort of problem with biomechanical interpretation from, say, gait analysis, if you can feed an AI with a load of photographs and videos of your patient moving, doing a squat, doing some running on a treadmill, and you're then feeding it, and all it can interpret it through is a lens of which it's been trained, which is spotting movement faults. This is a way in which I think technology can really proliferate some of the worst parts of MSK practice, for my taste, and strips it back and sort of ends up making us move backwards in time rather than forwards in time. But the allure of it being new and trendy would mean that it would feel like it was somehow more accurate, and that accuracy can actually be unhelpful. So the accuracy between someone's specific postural analysis based on a plumb line, we kind of have hopefully grown out of narrowly saying that you're moving differently to my perfect sort of postural plumb line, and therefore that's a dysfunction. The robots, unless they're trained to take that with a pinch of salt, might be more literal, and therefore the patient may well think, the accuracy of that technology is going to be beyond some person's pair of eyes, and therefore they're going to be maybe trusting the accuracy. And that accuracy is something that can feel alluring and tempting. It can feel almost person-centered. It can feel like it's really specific to them. But if it's not then put into its appropriate context to understand what to take with a pinch of salt, that might be a concern. So I'm concerned about that, sort of the gimmicks of it, but it doesn't necessarily mean that therefore it needs to be thrown away or ignored. It just maybe either the AI needs to be trained, or that we need to make sure that we are using these as tools, and we remain that person's the interface that then personalizes that within the relevance of the case in front of us, and we're then interpreting that information appropriately. And so that's one of the things that I think we need to really bear in mind. And this just speaks to what I consider to be then the compatibility problem. So if I look at that bottom there where it says use cases, compatibility, and then therapist replacement. So to move me on to my sort of second of those three, is the compatibility. I feel really strongly that the integration of AI into various different ways of our practice, namely some of the ones I've mentioned, although it's not an exhaustive list by any stretch, I think there is a massive compatibility for us to use this technology. It's not dissimilar to what I've said before about measurement tech, whereby you're using dynamometers or force plates or even motion capture type software. I think that these things do not end up being things that we need to be threatened by, but actually ways in which we can integrate them into our practice, create a massive amount of time efficiency for ourselves, and then move them forward and in furthering our ways in which we can advance MSK practice as a conduit between us and robots, us and technology. It can really supplement our care rather than replace it. Eventually, I spat it out. So I do think it's compatible. I think that where it's not is based on what I've just kind of described, whereby it can then be we're sometimes fighting against it if it's trying to be, it's wanting things to be black and white rather than shades of grey, if it isn't being trained on the nuance, if it's something that is almost directly interfacing with the patient. So, for example, I've had patients that before they've come to see me, they've put their scan results through ChatGPT, and sometimes it's failing to take the edge off the threatening behaviour that can exist around the low-grade spondylolisthesis. When a patient puts that through ChatGPT and finds out that is it says, please explain this in lay terms, then a slippage based on a spinal fracture is pretty threatening. And so the ability for me to then put that into an appropriate context with their symptoms, with their history, how recent and new we feel that is, means that then that was a really reassuring intervention for me, that ChatGPT was unlikely to, that the lack of literal empathy that it's going to be able to share in understanding how scary that might be to someone. It did its job. It put a spinal image report into lay language, but then happened to be that then the literal interpretation of that lay language of a slippage based on spinal fracture from an MRI is scary stuff. And so helping that person to understand it more was my job, and it came in the wrong order for my taste. And so it's not that was necessarily a bad thing, but it's just that we probably need to interpret that with them if possible, and trying to spot whether or not we can get upstream of the robots or alongside the robots, I think is an important one there for compatibility, because I do think that fundamentally that's where my head is at with this, is that I do think it is compatible. So on to then this therapist replacement thing. What is interesting about the AI use cases at the moment is that there's all sorts of things that are kind of alongside us, or tools that we might use, or ways in which content creators are using ChatGPT to enhance and assist their writing. We've got all sorts of ways in which we can then use it to ask it questions, and using it as a search engine, all those sorts of things that we can use in MSK, like we can use across any different area that we might want to learn more and educate ourselves on. What is interesting, though, is that we have got examples now of what are being considered AI physiotherapy services. So instead of, not as well as, but instead of a physiotherapist in the NHS, of which then is a team of physios that are working in an MSK department, seeing patients on a regular basis, be that initially through Zoom and phone calls, followed by then in-person assessments and treatment and rehabilitation, is that AI through what I understand to be sort of chatbots and even sort of recording conversations and things like that, and then interacting with patients to do then those initial subjective assessments, somewhat versions of objective assessments through video motion capture and things like that, to then make exercise prescription based on that and giving advice based on what they've told them. And that MSK process of treating and managing that pain and injury is being used instead of physiotherapists, because it can obviously hundreds of people could be doing that at the same time. You've not got the an easy way to chomp through a waiting list, for example. The interesting thing for me is that I can so understand how that might have some utility. I think it's got its limitations, I'm going to come to in a second. But the big one is, can that legitimately and legally be called physiotherapy? Like that's fascinating, and I can so understand why people are really frustrated about that. So if we park for a second how threatening that is to, say, the profession of physiotherapy and the MSK industry writ large, like how good for the industry is, I'm going to park that for a second, not because I don't want to go there, but because I just don't think it's as important as this next point for how people are most annoyed. And what I'll admit I'm more annoyed about is the fact that it seems pretty out there that is legally allowed to call itself physiotherapy. So physiotherapy is not a treatment technique. It is a regulated profession the world over, in the most part, but certainly in the UK it's regulated, and it's a well-defined scope of practice that is appropriately insured under certain things that it does and things that it doesn't do. It has a career structure. Granted, we can criticize that, and I do, but generally speaking, it's a long-time autonomous regulated profession, especially here in the UK and most of certainly the developed world. And so therefore, an AI that is mimicking some of the things that we do, namely taking subjective assessment questions and objectively testing someone's movement, and then creating a set of advice and rehabilitation prescription from that. Let's just say that's what that model's doing. And a lot of the ones that I've been seeing recently and the ones that have been commissioned within the NHS that have caused some controversy, that's fundamentally what they're doing. Is that physiotherapy? why is that allowed to be called physiotherapy? If they were to be doing the same thing where they're making advice, and then let's say that someone was so bold as to allow for that to then prescribe medication, would that be being called AI pharmacy without the appropriate checks and balances? Would that be that then if someone was to be doing that, would that be called an AI GP? And the risks that come from that are quite significant. And the reputational baggage that comes from that is significant. Are they replicating physiotherapy? They might not need to replicate the entire of physiotherapy for it to be legitimately called such, but I just find it really interesting that that it would be legally allowed to do that, right? So if someone that isn't a regulated physiotherapist on the HCPC register in the UK that had appropriately been deemed competent through that process and that had the appropriate qualifications, anyone that's doing that would declare themselves a physiotherapist, that would be illegal. It's fraud. And so the fact that then a robot, right? This server of which is then running these machines has not got at least bachelor's in physiotherapy. It is not registered and regulated through the HCPC, and therefore, why is it that these machines are allowed to call themselves physiotherapy? Whether they call themselves physiotherapists, I'm not sure. I've seen that. It's not literal robots, is it? But I'm just meaning these services are calling themselves physiotherapy. Now, I wonder, and this is what I've heard about recently, and I'm doing a bit of investigating at the moment, is that whether or not you've got a therapist or a team of therapists that then are basically then screening, triaging and managing some of the work. So it's certainly physiotherapists have fed and trained this AI, but then also it might well be that then the decision making is then verified by a physiotherapist, right? So you can imagine then if it wasn't clever robots, it was just a call center of therapy assistants, let's say, human therapy assistants, that then before anything goes out to patients, the decision making then goes through a specialist expert physiotherapist in that instance. I've heard in some ways that the checks and balances in place are human physiotherapists, and that's one of the reasons why it's then legally allowed to call itself that, or that it's legally dubious and that they're sort of taking a punt on them being challenged on that. But that's one of the things that's happening in the NHS. That's one of the things that then is proliferating, and I imagine that there's no reason why those sorts of services, and essentially it's just an algorithm, and so there's no reason why that wouldn't be able to be available, or that the same thing that he's doing that would be an extension to ChatGPT in the future and available as a free version on some or a paid version on a subscription. And so therefore, of course, the scale of which that can operate is something certainly cheaper than the humans of which it might consult. So no wonder people are sort of threatened by it. But there's also then interesting debates as to whether or not it's legitimately allowed to be called that. So a reflection on some of that is best done by my colleague Jo Turner. She wrote in MSK Mag relatively recently, a few months ago. Sorry, I'm still finding my way back around the software and system. But here's just the front page of Jo's article that she wrote in MSK Mag. And if you scan the top left corner on the QR code there of this screen, then that'll take you to Jo's article. She did a great job with that. For those that aren't familiar, MSK Mag is a monthly periodical by Physio Matters, producing content and now a print copy that can be delivered to your door. So go to mskmag.substack.com to subscribe to that. Or of course, if you're a Physio Matters member, you get that for free. Well, free, it's included in your membership. But yeah, check that QR code on the top left if you want to listen to Jo's thoughts on this, because they are very well informed and really interesting reflections from her as to why it's something that we should be thinking about, if not totally worried about. But also that the challenge it has to us, both as physiotherapists and all in the MSK community, is what is it that we do that is therefore unique? How can we appropriately legitimately personalize care in ways that the robots are unlikely to beat us? For those that are devout sort of manual therapists, or those whose care model is based on them particularly intervening through manual techniques or taping or brace application or acupuncture, or things that, of course, at the moment the robots are struggling behind us on, and they feel that actually the fact that physiotherapy and MSK has deviated too far away from those sorts of interventions is the reason that this has then left us vulnerable. And I understand that argument. I think, unfortunately, the way in which it's articulated means that to reduce MSK care to the administration of essentially pain relieving techniques is as reductive in lots of ways professionally as what you're fearful of the MSK machines and AI doing to us on exercise prescription and advice. And I think that that's what's interesting, is that I feel that there's this interesting balance, which I disagree with in both. I think physiotherapy or MSK practice being reduced to advice and exercise that makes us vulnerable to the robots doing that job because it's noddy, or that it's just a reasoning model that can be just applied more generically and less personally, then I can, that's something I'm not into. But similarly, if we think that MSK practice in its purest form involves a lot of doing things to people, and that the manipulation and massage and taping and braces and acupuncture and all that sort of stuff is so fundamental to the essence of what it is to be a quality MSK therapist, that is where we should lean more into that as a means of distinction from the AI. I think that would be a mistake. I think that would hark back to something that would be reductive and regressive. But I understand the point. I think there's something in between those two things, right? I don't think that the combination of the factors, the reasoning framework that helps us to give advice, the way in which we'd be able to engage with someone very personally as a human, we've got that advantage, right? We can empathize and they can empathize with us, is something that is going to be useful. The fact that we might then offer a rehabilitation advice that might not look that different to what an AI would do, and also could be informed by an AI program as well, if we were to use it as an interface, that compatibility I was mentioning before. If we did that, but also as a means of facilitating functional rehabilitation, we were able to lay our hands safely and sensibly. We were able to tape or to apply bracing or to do other techniques to and with patients, to involve ourselves and scale that rehabilitation carefully by having that knowledge to be able to when to stand close to someone that's doing a step up for the first time in a while on a knee that's sore, and being able to emote and empathize and to lay what wouldn't be considered manual therapy, but which would be reassuring touch within a functional rehabilitation model that I do all the time in my gym a few doors down from here. Good luck to the robots trying to do that, right? So you've got this interesting interface there where I think we need to reflect and not allow it to succumb to, let's be conspiratorial and say that's what the robots would want. They would want us to tear ourselves out in a hands-on, hands-off debate again, and rehashing those old arguments. Like, let's make sure we grow up and move past that and try and integrate these AI-related challenges to that story, I suppose, is the main thing. So I've said a lot there. I've got a lot to say, you can imagine, as usual, on everything, but particularly onto AI. It covers a lot of ground, and it won't be the last time we cover it on this show or in the future. But I'm certainly very interested in what you all think about this, and also for you to give me some feedback as to how you feel it's gone with regards to bringing the show back as a live format. I will love you and leave you for now, and make sure I turn off all my buttons. And if you tune in on Wednesdays at lunchtimes, you will see more of me in the coming weeks and months. But I really appreciate those that are watching live. If you have any feedback after the fact, then do feel free to post on the comments. We do spot those, and we will bring them into other shows and things like that as well. But if you'd rather, you can always then give us an email, info@physio-matters.com, for any more further thoughts on that, or post comments underneath Joe's article if you do indeed read that, because I think that was a really nice reflection of thoughts that we should all get behind and further the discussion, rather than having it all in isolation. We should sort of really try and work as a community to think, right, where do we stand on this? What do we think is okay? What isn't okay? What do we need to do to step up? I think that would be a really progressive way of working through this together. But thank you so much for now. I will love you and leave you. And until next time, I'll see you later. Cheers, folks.